Good evening to all the viewers who are watching live and will be watching as the recorded version. Um, I just welcome you this on this 41st CME, and the rest will be done by our other panelists. So, with this, let me just tell you a brief information that we were unable to provide the winner certificate for the winners, but we have sent the backstage link, studio link to them via email. So please, the winners, please check, and the winners will be announced by our inaugurator and others. So please do check via email. We have sent it, and the winner certificate will be sent on 28th January 2022. As we are having some server issues over here in our servers, so please cooperate with us. So with this, let's just start with the 30 seconds countdown time. Kalyani sir, maybe Dr. Vidut.
I think there's some problem with Bidyut. Anyway, good evening to everybody, especially today's inaugurator, Dr. Tousif Jamal Wasim, our moderator, beloved Professor Dr. Swapan of National Institute of Homoeopathy, and two eminent speakers, Dr. Himadri Bhaumik and Dr. Aniruddha. All the viewers on the screen, beyond the screen, everyone is very much welcome. Today is a great day for us, for India also. 23rd January, birthday of Netaji Subhash Chandra Bose, who was a successful son of the country. Anyway, with all the thanks, without wasting time, let us start CMA program. And over to our inaugurator, Dr. Tousif Jamal Wasim.
Good evening, everyone. Myself, Dr. Tousif Jamal Wasim from 25th batch. I welcome all of you to webinar by National Institute of Homoeopathy Alumni Association. From her, we can learn some knowledge which affects our daily practice and enriched our knowledge. So, thank you, Dr. Bidyut Mukherjee sir, Secretary of National Institute of Homoeopathy Alumni Association, for giving me an opportunity to inaugurate this 41st CME. I pay my request to Dr. Kalyani sir, President of National Institute of Homoeopathy Alumni Association. I am very happy today. Uh, we have Dr. Swapan sir from Materia Medica Department of NIH. He will act as moderator today. We have two eminent speakers, Dr. Himadri Bhaumik, lecturer in Department of Homeopathy Materia Medica at Northeastern Institute of Ayurveda and Homeopathy, Shillong, which is in Meghalaya. And second one is Dr. Aniruddha, lecturer in Department of Forensic Medicine and Toxicology Department from Moish Bhattacharya Medical College and Hospital. And we have announcement today. We have winners for today's CME free entry. Shoaib Ahmed, Dr. Kaji Fazle Haq, and Sandeep Chakravarti. Congratulations. No doubt we'll get valuable knowledge from these two topics that will help us in daily practice. I am requesting our moderator, Sir Dr. Swapan sir, to take over. Thank you.
Okay, good evening all who are connected in today's webinar. Myself, Dr. Swapan, uh, Assistant Professor, Department of Medica in National Institute of Homoeopathy. On behalf of National Institute of Homoeopathic Alumni Association, I welcome you all for today's webinar that will be presented on two different topics by our eminent speakers today. And I am very much thankful to the organizing committee of this Alumni Association for giving me a chance to act as moderator for this webinar session. And our first speaker, Dr. Himadri Bhaumik, he will be delivering his lecture on neglected tropical diseases. In short, it is known as NTDs. NTDs. So these neglected tropical diseases, as per WHO, they have identified 13 different diseases which are known to be as NTDs, like brucellosis, Chagas disease, cholera, dracunculosis, like that. The term neglected has many meanings. Seen from a political public health perspectives, it is an indication that these diseases were only recently discovered after having been overshadowed by many years by some big three diseases like HIV, malaria, or tuberculosis. From an equity perspective, entities are especially found in disadvantaged peoples. Thus, more than 70% of countries and territories affected by entities are low income, or we can say rather lower middle income countries. And this is partly because of the association with various combinations of social determinants, and partly because these populations are usually not in position to draw the attention of decision makers to their problems and attack the resources. The term tropical is not absolutely correct, as some entities like cholera or leprosy are not limited to specific climate zones. However, as a shorthand, the term points to where most of the entities as well as most disadvantaged people are found. And the entities are among these known as the type 3 diseases. That means these kind of diseases received extremely little research and development, and essentially no commercially based research and development is in the rich countries is done on these diseases, that entities. So from our speaker today, we'll be listening the other perspectives of entities and the integrated approach of treating this kind of diseases and its preventions that can be known from our speaker today, Dr. Himadri Bhaumik. So without further delay, I welcome Dr. Himadri Bhaumik to deliver his lecture and enlighten us with the topic. And we are sure that we'll be enriched after the this session with the topic and the very vivid description about the topic. And Dr. Himadri Bhumik, I know, is very much closely known to me. He was the PGT in our department, Materia Medica department in National Institute of Homoepathy. And about him, he is a very studious, I have seen from the very beginning. And he is very much sincere about treating the patients as well as in his study. Now he is the lecturer in this Northeast Homeopathic Medical College, that is in NEIH, na? Okay. So
Yes,
in
sir.
that, so in Shillong, now he is there, and I think he will be make the justice. He will do the justice, all justice to this topic. Yeah, I'm very much sure about that. So without further delay, I just welcome Dr. Himadri Bhaumik to deliver his speech.
Good evening to all the listeners. Thank you so much, Dr. Shopanpal sir, for a nice introduction about myself. And moreover, thank you so much, sir, you have briefly described about the entities. Uh, the very important point what you already have said, that these tropical diseases which are being neglected since few years, if we are saying from policy making point of view, if we are saying from research point of view, if we are saying from treatment point of view. So before sharing my slide, I just want to say that uh, hmm, when I have been informed that I have to present and seminar, so Dr. Bidyut Mukherjee da, he asked me to select a topic. So I was going through about different topics, and finally I came to know, because as at that time I was preparing for some my exams also, and I find that these different tropical diseases which are very means commonly we are finding in different part of our country, moreover in different part of our world. Most of the different countries are being affected by different tropical diseases, and which are mostly neglected by different point of view. Then I thought of taking these tropical diseases uh, with some integrated approach, like uh, being a homeopathic physician, what like following the approach, like different approach how to control these different tropical diseases in India or in the world. If we can introduce our system, if we can have some idea, if we can have some knowledge, if we can contribute to the society with our best effective treatment, then it will be a very effective and safe and very economic treatment to our uh, mm, different marginalized population. So thinking all this, then I decided to present that this topic, like integrated management of neglected tropical disease in India. When I have gone through this topic, I find that there are different approaches which are being governed by WHO, which are given by different other international organizations. And moreover we find that they never have been approached to alternative system of medicine. So rather we should find out our idea how to integrate with the concept of WHO, with the concept of other international organizations ideas. So with this, I just want to say that before starting my next slide, that next 30th of January, we are going to follow this World non-tropic non-tropic neglected tropical diseases day. This has been decided by WHO 2 years back, 2020. They have started to follow this a particular day to give more importance to different neglected tropical diseases in India. So that is also another point of my selection of topic. Like as we are approaching to the 30th January recently, so we should have some idea of different tropical diseases which are being more uh, prevalent in different parts of our state, different parts of our country, and moreover different parts of our world. So moving forwards to my next slide, here it is the outline of my total presentation. I divided the whole presentation in different segments. Dr. Shokunpal sir rightly mentioned about neglected diseases, like why it is called neglected. So before going to the main spectrum of diseases or the different approach of diseases, we should know about the history of this uh, history behind the trade, or you can say the this brand name, why it is called neglected tropical disease. So we will discuss about some history, followed by we'll try to find out some very common features and significance of these entities. different entities. Then we'll try to rule out some spectrum of entities in different part of the world. What are the different entities? As already Dr. Shopanpal sir mentioned, that 13 major entities has been find out by WHO, but currently we know that it has been increased to 20 number of entities. Then we have to follow some global burden. What is the exact effect of these different entities globally? Then we'll try to rule out the exact scenario of our country, that is India. Then followed by we'll try to rule out the general diagnostic aspect of different entities. We need to find out like what are those different diagnostic approach we should follow for different particular type of neglected tropical diseases. Then we'll discuss about integrated approach, uh, followed by some challenges, then how to eliminate those these neglected tropical diseases in India. And simultaneously we also will discuss about opportunities for control of neglected tropical diseases in India. So this slide will discuss about my next all slides. And simultaneously I have given a picture of this 2130. So I think some of you have like raised some doubts like why it is 2130. Because 2130, it is a mission of next 10 years mission, how to control these neglected tropical diseases in different parts of world, like we'll discuss in our next slide. So history behind the name, like why we have given this name like neglected tropical diseases. Like we know there are millennium development goals. We know there are 8 international development goals which was established by United Nations during a meeting in the year 2000. And it's supposed to be followed up to 2015. Like most of the different countries, like 189 United Nations and other 23 international organizations, they come together. They come together and committed to achieve these following 8 Millennium Development Goals by 2015. But from 2016 onwards, these sustainable development goals were succeeded by these Millennium Development Goals. So now we are approaching towards 2030. So our targets to achieve these different 17 international sustainable developmental goals. So if we discuss about these 8 millennium development goals which was being like formulated by different United Nations in the year 2000, they have formulated these different 8 goals. Here we find like in the uh, sixth number, that to combat HIV, AIDS, malaria, and other diseases. Like Dr. Shopanpal sir rightly mentioned about like some diseases we are focusing for, like HIV, AIDS, malaria, and other diseases. So to fight against these different diseases, we need to have some idea like how to have some knowledge to control about these different diseases which are being more prevalent in recent different years. Then following these millennium development goals, like to fight against these, like my last slide I should show you again, like to fight against these HIV, AIDS, malaria, and other diseases. uh, there was like group of concerned scientists and public health experts who come in front, and they have some discussion about these different parasitic helminths and protozoal infections under WHO. And they have taken some measures like how to globally they have control, they can control these different tropical diseases which are being more prevalent during last 1 or 2 decades. Then initial years they find that, like I'm speaking about 2000 onwards, they started like discovering different diseases in different part of the world. And initially, what Dr. Shopanpal sir mentioned, that yes, correctly sir has mentioned about 13 major conditions was first identified in different parts of the world, including India. And now, if we see the WHO or the PLOS medicine, the public library of science medicine, in that section we'll find that another seven major conditions has been added with these 13 existing major conditions. So right now we are focusing for 20 major conditions which are more prevalent in different part of the world. Then we find that in the year 2001, an interesting study was done in India, like for the development of research and some, to ruled out uh, some developmental procedures, or some research procedures. They find some neglected infectious diseases in different parts of our country, and finally they means in the year 2001 they first uh, isolated this word, like these neglected infectious and tropical diseases. It was first being used during this 2001, followed by we find that neglected tropical disease, these particular terminology was used in one paper which was being published in 2005 in PLOS medicine. Followed by we find that 2005 and 6 onwards, these neglected tropical diseases is continuously available in different database search engine, including PubMed also. So this is a chronological evolution of this neglected tropical disease. Now followed by 2007 October, we find that the Public Library of Science, they have started an open access journal. Means if we open our any search engine, if we uh, open the Public Library of Science of Medicine, in that sections they have separately developed one neglected tropical disease site. So there are lot of articles, lot of database research methodologies, the upcoming treatment procedures, the developmental policies. These are being updated in regular point of view. Then followed by another very important part is that 2003 WHO and this Medicine Sans Frontiers MSF and another five international research institution, they have started these different drugs for neglected diseases initiative. So the name is DNDI, especially for six deadly diseases. So 2006 onwards, they have started distributing different types of medicines for different types of these neglected tropical diseases in different parts of the world. And finally, we find out that WHO also has introduced a separate department for neglected tropical diseases. So this is the chronological evolution of these neglected tropical diseases. So initially, we find that the neglected tropical diseases, the name was so isolated, and finally we now have the department. Now we have other particular site for all these different neglected tropical diseases in different part of the world. Now coming to, so this way, like if we can say, like how this neglected tropical disease, it got its own name, its own identification. Then followed by we find out, like we should know about what is exactly the neglected tropical diseases. Like sir already rightly said that these diseases affect the devastating populations, the marginalized populations. So we find that from the database search engine, or even from different statistical records, we find that these neglected tropical diseases are diverse group of different diseases, mostly the 20 conditions. Recently WHO has updated with these different 20 conditions. Initially it was 13, right now it is 20 conditions, mostly affect more than 1 billion peoples living in remote, rural and deprived urban settings, that is impoverished communities of tropical and subtropical countries caused by different types of pathogens, including your viruses, bacteria, parasites, fungi, and different toxins. So basically these neglected tropical diseases, it affects the poverty, the low lying peoples, the low income countries, the lower socioeconomic groups, which are being more particularly affected by these different 20 number of major neglected tropical diseases. And these idea, these exact definition of these neglected tropical disease we find in different areas, but I find these one uh, published article which was published in National Library of Medicines. So in that I find, and then finally I put up here, then followed by we should know like that neglected tropical diseases have some common features. So we should know about those very, very common features. What are those very common features? We find that a proxy of poverty and disadvantages. Yes, this is these diseases, these particular type of diseases mainly affect the marginalized populations, the low socioeconomic populations, low socioeconomic conditions. And finally we also find that it affects population with low visibility and little political voice. Yes, it is also true. It do not travel widely. Yes, we find that these diseases mostly confined to particular areas. It is not so commonly spreaded to different part of the world. It's spreaded, it is isolated. We find that most of the countries 189 around 189 countries are being affected by these different diseases. But the infection, it doesn't spread so rapidly. Even we find that when a part of the nation, or when a part of the world being affected by these entities, we find there are a lot of social stigma and discrimination. And we also find that these entities are very commonly related with some chronic disabilities and social discriminations. And finally we also find that these mostly affect the girls and women. We'll discuss about these points. Then we also find that these have an important impact on morbidity and mortality. Yes, we find that these Burul's ulcer, if we say, or leprosy, if we say cystosomiasis, if we say dracunculosis, if we say dengue, if we say onchocerciasis, so many different types of entities which affects. But one data we find that these entities, different entities, it increases the morbidity rate. Mortality rate, it is quite low, but still we find some rate of mortality also. But compared to mortality, the rate of morbidity is more in different part of the world, including even in our country also. Simultaneously we also find, as already Dr. Shapanpal sir rightly mentioned, that yes, why it is being neglected, because hardly we are doing any kind of research on these different diseases. What about the different diseases we find in our country? Like we in India, we commonly find 11 entities are very common in different part of our country, but very less number of research are coming up with these different 11 neglected tropical diseases. So it is another very important point, like where we should focus on. Then finally we also find that if we take some preventive measures, if we can take some effective measures, if we propagate, if we share our knowledge, if we approach integrated way, like if we treat this disease in integrated approach way, then definitely we can have some good scope to control these different infectious disease which are commonly prevalent in different parts of our country. So this isn't just a general idea of entities. Now followed by this, why these, they are called neglected tropical disease. Yes, I already said that these first disease, it mostly or commonly it is available in tropical countries or subtropical countries. Followed by another very important part is that these greater and lesser extent being neglected by funders researchers, and policymakers. Yes, these are the three areas where we should give more focus on. Basically, we hardly find that like any organizations comes up with like giving much fund or raising fund to control these or to do some kind of research work on these different entities. Even we find that the researcher are also are keeping very less interest on this topic. And even we also find that there is less amount of or like there is underdevelopment of policymakers. Means we are not in a road to make some good policy making for these to control these entities in our countries. So these 2 points are very important. Why and on the basis of these 2 points we can say that these 11 the common, very common tropical disease which are being more prevalent in our country, these are being neglected. Now, yes, now going to next slide, we should discuss about some features and significance of these entities. It is very difficult to cover up these all diseases. I'm not going to take up all the disease individually. Rather, I should focus on like the basic part of all the entities, the basic approach of for the different entities in general way. So that is why I'm keeping here in general concept. So features and significance of entities, if we find that the 20 entities represent the most common infections of people living in extreme poverty in sub-Saharan Africa, Asia, Latin America, and the Caribbean. So including our country also, Southeast Asia also, there are a lot of upcoming these entities which are being more prevalent in different parts of our country. So followed by these, we also find that they disproportionately affect the bottom billion peoples, which refer to approximately 1.4 billion. Can you imagine, like 1.4 billion people who live below the World Bank poverty figures of US dollar 1.25 per day, rupees per day, in and around like 120 to 150 rupees per day if we calculate with our currency. So it affects 1.4 billion peoples. About that, we also can say that these bottom million people, the entities result in chronic infections. Yes, the most of the peoples we find that which are being affected by these different entities, like if I say very common infections in our country, that soil transmitted helminthiasis or other infectious diseases like your leprosy or leishmaniasis, visceral leishmaniasis, even scabies. So these are the very common diseases which are easily available in our country, and which mostly affect these different people which are living there below poverty line. Now, followed by this, we find that these entities produces chronic disability that result in impaired child growth. Yes, we find that most of the people, most of the those who are being affected by these different entities, we find there is a lack of growth. We find there is some impaired cognitive development. Even we find there is some complications related to pregnancy also. And finally, what we find that these two group of people, mostly it covers our like total population, 33% of our total populations, which are being affected by these entities. And finally we find that it ultimately affects the this economic growth. Then we also find the entities adversely affect not only the health but also the childhood education. Yes, it is also right. And ultimately economic productivity. The entities represent an underlying reason from bottom billion who cannot escape poverty. Yes, we know these diseases are very common in poverty. They cannot come out from their daily living conditions, and finally they are being affected by these diseases, and finally ultimately it affects our economic growth. Many of these entities also causes blindness and disfigurement that causes psychologically devastating and result in social stigma. I already have discussed about this point. Now, followed by this, we also find that I already said that these entities mostly causes chronic ailments, um, and we find the morbidity rate is quite high if we compare with the mortality conditions. So finally, we find that people who are being affected by different entities, we find the rate of morbidity is quite high. So these are very important, some general features for these neglected tropical diseases. I'm not going to discuss like individual features of all the different entities, because it will be a very huge topic. So rather, considering in general entities, I should focus on the general uh, general problems. Now, if we say the spectrum of entities, yes, if we see the spectrum of entities, there are different types of infections, there are different types of diseases which are being more prevalent in different parts of the world. So here we can see there are 20 number of infectious diseases which comes under these different conditions. So if we say protozoal infections, so leishmaniasis, Chagas disease, followed by these helminthiasis. These helminthiasis, or we can say this soil transmitted, worm infections or parasitic infections also, it comes under these helminthing infections, followed by ectoparasite infections like scabies, which is very common. I can tell you, I can share my own experience. I am right currently I am giving my service as a lecturer in the department of homeopathic Materia Medica in Shillong. So regularly I am attending OPDs. Even in our journal, one study has already been published, like in Meghalaya, means it is means how to say, how to like express my experience, because I have seen, I think out of 10, 5 to 6 people will come to OPD with the features of these scabies. There are so many number of scabies are available in Meghalaya. So these kind of infections, if we find most of the part of the most of different parts of our country. So scabies are very common infections. Mostly we find it is also in low socioeconomic conditions, where they cannot maintain their proper hygienic conditions, they cannot go for good sanitations. So we find these are very common infections, followed by viral infections. Dengue, yes, NIH is a very good example for dengue. I remember 2011, uh, our different respected doctors from NIH. I should take a name of Dr. Pralay Sharma sir, or other respected teachers who have taken a good initiative to control this dengue. They have distributed medicines also in different part of our Kolkata districts and all. So we find this dengue, chikungunya in Delhi also. It is very common in this chikungunya and dengue. Followed by rabies, we know much more prevalent in India. Followed by bacterial infections. Yes, trachoma. We know the very important or foremost cause of blindness, that is trachoma, which is more prevalent in South India, and it is more prevalent in our country. So this is also comes under these bacterial infections. Burul's ulcer, it is quite rare infections in our country. Yours, it is already been eliminated. Followed by fungal infections, mycetoma also, it is rare conditions in our country. And followed by chromo blastomycosis. This is also another fungal infections, mostly affect the skins of foots and hands and a back part of our body. Followed by snake bites. So these spectrum of 20 number of different diseases which are more prevalent in different part of the world. Now just this is in one image how we can divide these different infections in a different way. Now, if we discuss about the global burden, will like have an expression like, if we see more than 149 countries are endemic for different entities. The data, if I want to put here, it will be huge data. I have gone through these WHO sites, even these PLOS medicine sites, that neglected tropical disease. They have extensively done different research methods. They already have published a lot of data on different entities, and we find that 2 to 5 number of entities are more prevalent in these 100 countries. And you can include our country, that is India also, because we usually find 11 number of these entities are more prevalent in India, then followed by 6 or more in different entities are more prevalent in 30 number of countries, which affect more. The total entities affect more than 1 billion people suffer from one or more entities. And if we find more than 5 lakhs death and 25 millions daily per year, daily, that is disability adjusted life year. So these 25 million daily, like people who are being affected by some diseases, and ultimately because of that diseases they become disable. They cannot perform their daily activities, they cannot perform their duties, and ultimately it affects our economic growth. So from these data we can easily find out that how many numbers of people are being affected by these entities, and how these different entities ultimately affects in the economic growth of India, even the other countries. So this is a global burden, followed by, here I have shown you this, like, the different very common entities in globally. Like you can see this approximate global prevalence per million, that is 576 millions of people are suffering from hookworm infections. And out of these 1 million of people who are suffering from these daily, means those who comes under this daily, that they are ultimately they are, we can say, contributor in the economic growth. Means like they, because of these people, means our economic means growth are being affected regularly. So these are the different diseases, followed by ascariasis, trichuriasis, lymphatic filariasis. So the data, it is being published by WHO, and ultimately we can ruled out how these different entities ultimately affects in the economic growth of different countries, including our nation. So this is South India and South Asian scenario. Like these are the different countries like Bangladesh, Bhutan, Nepal, Pakistan, Afghanistan, and including our country India. So these all the countries are being affected by these different entities. Now, if we come out to India's layout, then we find these are the different 11 very important infections we find in different part of our country, like visceral leishmaniasis, soil transmitted helminthiasis, lymphatic filariasis, echinococcus granulosus, or echinococcosis, that is tapeworm infections. Then cysticercosis, trichuriasis, leprosy, trachoma, dengue fever, rabies, and scabies. So these are 11 number of diseases which are more common in India. So here it is the data of India. So you can see this ascariasis or hookworm disease. How globally you all can see that India rank number one. And moreover, see the number of infections in 2016, 222.2 millions of people being affected by these ascariasis, followed by the other diseases. And ultimately we can see the percentage of cases found in India during 2016, that it is total number of cases in globally, that is 799.7 million, and out of that 28% of cases we find in India. So this is the data which we find for these a different 11 number of diseases which are more prevalent in different parts of our country, and we can easily identify, we can easily say that how these number of people are being affected, and ultimately how these number of people being directly related with the economic growth of our nation. Now, coming to diagnostic aspect, like how to diagnose these different entities in general way. I'm not going to discuss like individual disease. So we find that whenever we do some diagnosis for these different entities, we are facing some problems with availability of taste. So here I put some points like the lack of rapid, accurate, and simple to use point of care test for many of neglected tropical diseases in an important feature for their general neglect and underappreciation of their disease burden. Yes, because we do not have repeat taste, or we do not have such kind of taste which easily we can perform for different entities. So this is another very cons we can say for these different entities. Microscopy, yes, microscopy remain the mainstay of diagnosis for majority of entities, but as we can say, this microscopy is the one very important diagnostic approach for different entities, but in all peripheral units, subcenters, or you can say like PSCs, primary healthcare centers, or in some district level also, we find that these microscopy tests for different entities are not available. So this is another very important factors where we are lagging behind. Then, while microscopy of parasite is considered as highly specific, its sensitivity depends on the intensity of infection. Yes, we said that microscopic infection, like examination for different entities, are very specific, but it mainly depends on its rate of infections. So, like in acute state, like which is a function of number, like in acute state when the rate of infection is very high, there we can say that this microscopy will be very effective one. But as I already said that these microscopic tests are not easily available in different parts of our country, like sitting in sub center level or sitting in primary health care level, it is very difficult to perform this test. Then immunodiagnosis is applicable for most of the neglected tropical disease, but may lack sensitivity and specificity. Yes, immunodiagnosis like maybe antibody test or antigen test we can perform, but if we say sensitivity and specificity wise, it doesn't have much role. Then antibodies produced against one helminth species are known to cross-react with antigens from other helminths. So these are different procedures which we perform for different these entities. But most important is that the microscopy and immunodiagnosis test. The next part is the commercial availability of standard test kit is still the exception rather than the norms. Yes, I already said most of the tests are not easily available in different parts of our country. So it is another very important point we need to look out for. Then the development and use of molecular tools such as PCR test, polymerase chain reaction test for the diagnosis of neglected tropical diseases is the focus of multiple research group, but the commercial availability of DNA amplification test kits are rare. Yes, these test kits, which should be readily available in different parts of our country, it is also not available. So there also we are facing a lot of troubles. According to some authors, multiparasitic screening based on molecular assay might one day replace microscopy and immunodiagnosis. These are upcoming procedures. Some research are going on. So we can expect some more some more expected test, future test, which easily or readily available in different parts of our country. But uh, we need to work upon all those areas. Now, the very important part, that is the challenges to eliminate neglected tropical diseases in India. So what we discussed, we started with the history of these neglected tropical diseases. We said about the different entities which are commonly available in India, followed by we discuss about these uh, like the different spectrum of diseases which are available in different part of the world, including this India, followed by the diagnostic aspect also we discuss. Now, how to combat this situation, these for these different 11 available neglected tropical diseases in India. The very important problem, like when we are going to handle, or when we are going to implement some ideas, we are facing trouble. So the very important trouble we find, that is operational problem in implementation of programs. We know that government of India has implemented already different control programs for different diseases, but we find that like whenever we are implying those ideas socially, we are facing a lot of troubles. Means we are exactly we are not exactly in a state to amplify those ideas socially or in the field level. So there are three factors which are more responsible for this implementation of programs. Like, we find that there is shortage of staff in the district level. Another, we find that there is lack of intersectoral coordinations, particularly with the local bodies and panchayat raj institutions. Means we do not have exact coordinations, participations with the local bodies. That is another very important part where we should work upon. Then we find that different states, different cities are coming up with different constructions. A lot of constructions are coming, unprogrammic constructions, ultimately which influences these breeding places for these different vectors, and ultimately we find the infection rate is high for those particular areas. So when we are finding, like suppose when we have such program in our hand, but we do not have exact idea how to implement those conditions in the field level. So there we should work upon how to minimize those problem, and how to means participate in group way, how to act means like in group way, so that at least some integrated approach will come out for these neglected tropical diseases. So this is another very important part, that is the operational problem. Like, we cannot implement our programs in the field level. Second, the very important part, that is lack of basic sanitation and safe water. Yes, in India we find that a large number of populations does not have, or they cannot access basic sanitation, safe water supply. So provision of sanitation and even basic amenities, it's still a challenge for our country. So we should work upon those areas to improve the basic sanitation, at least the safe water supply and hygienic conditions to our society. Another very important, that is stigma and discriminations. Yes, uh, as I already said, that these neglected tropical diseases, it affects in different way. Chronically it affects, and ultimately it disable the people, it disfigures the body, and ultimately it become a stigma and discrimination for some group of people, especially the women. So here stigma and discrimination may prevent people for attending health services. They don't have exact idea about the disease process. They feel shy to approach to the health system. So we need to work upon those areas. We need to do a lot of community awareness programs. We need to implement different health staffs. We need to act like more upon those sharing different knowledges to the health staffs, and like develop those ideas in these staffs, and ultimately, we can act cordially in these areas. Then followed by, we find geographic and climatic diversity. Yes, in our country we find there are different seasons, different places are being affected by these, cyclones, and these floods and all. And ultimately, if we approach to those rural areas, it's become a difficult part for those health, personals, like how should approach to those areas during this, cyclone time or this flood season. So to reach those areas, it become very difficult for them. So we need to work upon those areas. Coexistence of other disease, we find that some entities are, coexisted with different diseases. For an example, I should say that visceral leishmaniasis are very common in HIV group of people, and we find that Bihar is the very important state where we find visceral leishmaniasis cases are more, and we find that these people are being affected by, means HIV people. These people are being affected by visceral leishmaniasis, and it become a hardest situation for health personnels to take over those conditions. So this is another area where we should do more research, where we should take out more data. We should do regular surveillance, we should do some monitoring programs, so that we can generate some data, and on the basis of those data we can come up with some new approach, new ideas to combat these situations. Finally, we should say that we need some monitoring and surveillance. Yes, effective surveillance and monitoring is urgently required for to generate some data, and ultimately those data will help us to make some policies, to develop some appropriate strategies for taking care of these different 11 available entities in our country. We need community mobilizations. Yes, we need community participations. We need to formulate a lot of community awareness programs. We need to encourage people in different way, we should more focus on IEC activities, that is information, education and communication activities. We should distribute a lot of ideas. We should share our knowledge by doing some community activities, by doing some programs, so that these awareness will be easily reach to our these marginalized population. Then we need sustaining political commitment. Yes, Dr. Schopenhauer sir rightly said, because uh, we know that India is right now facing it's like lot of non-communicable diseases, and political sustainment, these different policies are coming for non-communicable diseases, like we can say for diabetes, for hypertension, for obesity, for different for different cancers, rheumatic heart disease, ischemic heart disease. So, but we are not looking after these entities. So we need some sustaining political commitment to improve these areas, so that a lot of research we can expect in near future, and a lot of development we should see in near futures to combat this situation. And finally, we should do a lot of research work, means like from homeopathic point of view also. It's my earnest request to the authorities, the higher authorities, the different departments. They should come up with their ideas. They should do the different research program, different clinical verification programs with these different available 11 entities. We know we already have done some project work on Japanese encephalitis. We have worked on dengue also, filaria also. But we should come up with more research work. We should develop some more ideas, so that at least homeopathy also can contribute some ideas to those sections. Now, followed by, this is another area, like what are those opportunities for controlling these neglected tropical diseases in India. So I should take some points, like here political commitment. Yes, India have signed MOU, like memorandum of understanding, with Bangladesh and Nepal to eliminate Kala-Azar in the year 2015. Sorry, and even 2014 also, India have signed another MOU with Bhutan, Thailand, and these other three countries for the elimination of different entities, and their target was 2017. But the current data, it is not available, so they are still working upon those areas. So we need political commitment, so that we should have different MOUs with different countries, so that different programs, those fundraisers, they will come up with their own ideas, their contributions will help us to combat this situation. Yes, next is supporting programs for opportunities. If we say the government of India has launched this Swachh Bharat Abhiyan, Clean India Mission in 2014, and we know that our idea to take up this mission, to provide these safe water, basic sanitation to these marginalized populations in our country. So this is another area where we should work more, so that we can expect some good result by doing such programs. Then followed by epidemiology of neglected tropical diseases. These diseases are endemic in limited areas. Yes, this is another advantage of, you can say, entities, because we find that some areas are more confined to some diseases. So these if we have the general knowledge of these different diseases, like those areas which are being more endemic to those 11 available entity tropical diseases in India, if we work upon those areas, if we develop more research work, if we work in the field level, if we give our best to those section of peoples, then we can easily combat this situation by 2030. Then availability of diagnostics tools and this treatment. Most of the recommended intervention, that is simple diagnostic tools and effective low cost treatments, are available for the most neglected tropical diseases. Yes, it
So,
is.
sorry for the interruption, Dr. Himadri. So we are having shortage of time. So can you wind up very shortly with your next part of the presentation?
Yes, sir.
Okay, thank you. Thank you so much.
Okay. So here, like these are the areas where we should work upon. These are the different opportunities. Yes, primary healthcare centers. Here also we can work upon more nicely to strong these areas like primary healthcare system. If we work upon these areas, we can easily combat this situation. Then followed by, this is the last approach, that integrated approach, which has been given, which already have given by this WHO. There are 5 basic interventions they have given, that is preventive chemotherapy, then innovative and intensified disease management, vector ecology management, veterinary public health services, and provision of safe water, sanitation, and hygiene. So these are the 5 areas. Why I have given in the last section of this, because we, as a homeopathic physician, we also have a lot of areas, we also have a lot of scope to work upon these areas. If we say like preventive chemotherapy, their idea is to distribute different drugs in mass, like they are distributing avendazole or ivermectin, uh, because these are easy to administer, they are very much efficacy, they have much efficacy, is very safe and minimal side effects. So why not homeopathy can contribute our own drugs here, and we can come up with our medicines in this situation. This is one area where we should work upon, that is preventive chemotherapy. Second, there is innovative and intensified disease management. Yes, here also we should work upon, like we are all are qualified homeopathic physicians, we know how to diagnose these different entities. So easily we can come up with different elimination programs or eradication programs uh, with other system of medicines. And these vector ecology and management, yes, these are basic ideas how to control these vectors, like judicious employment of pesticides, along with community participations, coordinations, even the safe sanitations or piped water supply. So these ideas are very common ideas, so they are also homeopathy can contribute. We can also work upon these areas to improve the basic sanitation of these marginalized populations. Then finally, veterinary public health services and provision of safe water, sanitation, and hygiene. So these are very common areas where we also come together in integrated way, so that the all people will get a good health, and they can like in a situation they can control these conditions in better way. So these are the targets. Like here it is not so visible, I think, but you can say these 2020, 2023, 25, and 2030. I just want to tell you one thing: the trichonculosis, we know this has been already means eliminated. The number of counter certified free of transmission, you can see this 100% target they are keeping for 2030. So these are the different diseases. Who has WHO kept these diseases in the list to combat this situation by 2030. So this is my the final area, that an integrated approach to NTD activities is expected to result in better health outcomes, greater cost efficacy and effectiveness, and better program management. So yes, we should, as a homeopathic physician, we also should come up with this different research project, different areas, different research project, different clinical programs, so that we also can contribute some of our knowledge to combat this situation. Thank you so much. Thank you, Kalyani sir, for giving me such an opportunity to share some knowledge. Thank you, Dr. Bidyut Mukherjee to give me this platform to share my knowledge. And finally, thank you to all of you.
Thank you very much, Dr. Himadri, for giving such a wonderful presentation on the topic, these neglected tropical diseases. Its overview from starting from the historical background, its significance, then global burden, Indian this history, and diagnostic approach, integrated approach more particularly. And you have rightly pointed out that some kind of research work should be done on this aspect, because this is one of the neglected area. Some researchers are not taking up their project on this aspect, so that should be there. And ultimately, you have said that homeopathy have many things to do in this area. So we must think over that to take up as a research project in different studies and different institutions, and as well as at the this personal level also. And I must thank the viewers, and I have known that more than 150 viewers, live viewers, are present there. And I'm very much thankful. And now it is 160, so lots of viewers are there. And I must be very much thankful to all the viewers for your constant support and for your presence in this webinar. As well, in the last all webinars, you have constantly supported us, and we hope to get your presence in further seminars and webinars also. So with this, we are moving to our next part of this webinar, and that will be presented by Dr. Aniruddha. He is the lecturer of Mahesh Bhattacharya Homeopathic Medical College, and he is very much closely known to me also, because he was the this PGT in Materia Medica department at National Institute of Homeopathy, Materia Medica department. And regarding him, he is a very uh, what I can say, very inquisitive. He has a very inquisitive mind. He goes deep into the subject, and he tried to get all the knowledge in a particular subject. He was a very studious, definitely, and we hope that we are going to get some more elaborative discussion on Ignatia and different aspects. And regarding this medicine, we know it is a very commonly used medicine in our clinics for some mental aspects. And this remedy, there is a great strain upon the emotional centers. We know that recurrent shocks develop the sensitivity and aversion of personality and confusion in the normal rhythm of the thought mechanism and decision in action, and which leads to various forms of irrational behavior. And Ignatia basically typifies the irresolution throughout the mental function, a heartbreaking jumble of the contradictory impulses, immature information, and destructive inaction. This characteristic symptom places the remedy in a position for easy selection. So there are a lot many things to describe. I just welcome Dr. Aniruddha Nag for giving his lecture on the topic Ignatia and its various aspects. So welcome, Dr. Aniruddha.
Am I audible? Am I audible?
Sir, you're audible, but not. Sir, you're audible, but not visible, sir.
No, I have switched on the cam.
Ah, now you're
Okay,
visible, sir.
okay. Thank you.
Over
So,
to you.
uh, thanks a lot, Dr. Swapan sir. After a long time presenting a presentation and what to say in the nutshell, you have said all the things about Ignatia. But today, uh, we are not going to study Ignatia as a drug in whole. As the topic is suggesting, my topic is Ignatia, the distressed mistress. You can see that today in this situation, in this pandemic situation, in this COVID situation, when there is lots of mutations of the viruses, and the modern medical world is thriving hard to get a suitable remedy and a suitable medicine for this COVID 19, and the virus is keeping on mutating itself. So the experts are only focusing on the point that raise your immunity, and for raising this immunity, it's very important to maintain a proper lifestyle, to maintain a proper mental and physical well-being. And here comes the role of our homeopathy, because we homeopaths usually our approach is very holistic, and we usually stress on this mental and physical well-being. And here, as the name is suggesting, my topic, the distressed mistressed, I shall begin with a very common term, that is the emotional distress syndrome. And I shall just go into some features of this particular condition. What is emotional distress? What is emotional distress syndrome? And then we shall see how our homeopathy, and here particularly Ignatia, is helping in this particular situation. So, uh, before beginning, I just want to ask: is the slides visible?
No, sir.
Is it
Sir, let me
visible?
guide you with this. No, sir.
Okay.
Let me guide you with this. You have not shared the
Okay.
screen yet. Sir, please just click on the share button, and
Yeah.
then you have to share screen. Then again, option will pop up, calling up for share screen. Then a portion in a white portion, you will see your screen in a small formatted version. Just click on
Yeah.
that
Yeah.
and share. and
Okay.
don't click on anything else. Okay, sir. Now you can just turn on your slides. Is the turn on the slide page, sir?
Okay. Now is it visible?
Yes, sir. Please do
Okay.
open the slideshow option, sir,
Okay. Yeah. Yeah.
and click on
Sure.
the hide button, right beside the stop sharing one.
Okay. Okay.
Over to you, sir.
Now, now is it okay?
Yes, sir. It's okay. Yes, sir. You can
Yes.
go on.
Yes.
Over to you,
Ignatia,
sir.
the distress mistress. So now you can see the pictorial picture about this the distressed mistress. Just to make it a bit interesting, I have put these pictures. How a distressed person behaves and how he or she looks. Here, particularly the Ignatia. Okay. Now, what is emotional distress? As you can see, that emotional distress, the term suggests emotional distress is a state of emotional suffering which encompasses a wide range of symptoms, but its hallmarks are the symptoms of depression and anxiety, and this can be experienced at any time and is usually temporary. So we can see that this emotional distress can happen to many of us. Any of us can experience this situation, and it actually you cannot just simply identify it with a particular symptom. It includes a wide variety of symptoms over here. And so we are going to see in the next slide what does it actually encompass. So it's a state of mental anguish that can take a wide variety of forms and may result from a mental health issue or particular substances such as relationship difficulties or financial strain. So we are seeing in today's this world so many circumstances we are facing. Here, this mental state of mental anguish can arise from any of these circumstances. So emotional distress can be either be a consequence of any mental health disorders. Either the person is suffering from a mental disorder, which is usually chronic in nature, persisting for long periods, or it can, the small incidents can develop into a mental disorder. So it can be both way. Either the person is a mentally challenged person, mentally disordered person, and there this syndrome of emotional distress is developing, or the continuous repetition of this distressed circumstance can lead to a chronic mental health disorder state. If we look at these causative factors of emotional distress, here it's already I have put, it's usually variable. These causative factors and often involve a combination of several factors. Example, due to traumatic experience or event like death in the family, or it can result from a wide range of underlying mental conditions. So there can be a trigger factor, or there can be an underlying mental condition. Now here we shall just uh, see in a nutshell what are the situations that can trigger an emotional distress, and in what ways we can classify this. Number one, we shall take emotional distress at the workplace. Now this is very much common in today's corporate world, in and also in any type of job. We can see how this pressure develops. So what are those? The causes here include concerns about job security. As we can see that in this situation, especially in this after this emergence of COVID-19, lots of people are losing their jobs, and there is very little job security. Uh, Few people are with a very secure job, are in a position of secure job, and most of these jobs today, whatever be it in the government sector or private sector, they are being taken in as contractual, and you don't know when this can end. So there are lots of insecurity about jobs. Then there is concerns about performance. This especially occurs in this corporate world. And then there is long hours you have to work. There's constant pressure. There is low play, means you have little time for the recreation. 8, 10, 12, 14 hours of jobs the persons are doing. And then again a very very what to say, office politics. I think I should not go into details about this. Most of us are very much well aware of this, how this office politics affects our mental health and in turn the physical health. The corporate environment, those who work in the corporate environment, they are very well aware of this, how much difficult and how much tight this corporate world is. Poor working conditions, this usually occurs in these especially the group C, group D conditions, where the people have to work in a very poor working conditions. Lack of control over work and situations, you don't have any control over the circumstances. Then gradually increasing responsibility and relationships with colleagues and managers. Next is the emotional distress at home. In home also, and in today's fast world, you can see this relationship problem with the partners, other family members or friends. This increasing rise in this ego problem between the partners. Then there is increased incidence of divorces within the family. Then there are neighborhood problems, and staying in a neighborhood that faces inequity and a deprivation of resources, there also this distress develops. Undergoing major changes in life, like changes in house, job, having a child, or during the menopause. You can see in our Materia Medica, lots of drugs are there where this point is targeted. Having low income or debt, you are earning low and you are constantly facing the financial strains within the family. So how much stressful the condition is becoming, we are all aware of it. Suffering from indiscrimination, feeling of loneliness or isolation. You are earning low, so your family members are discriminating you. Your brother is earning more, or your some other family member is earning more. There is constant comparison within the family, and this is leading to this feeling of dejection, and then unhealthy lifestyle. Now coming to the symptoms of emotional distress. What are the symptoms? Feeling overwhelmed, helpless or hopeless, spending much of the time worrying about the complaint, feeling guilty without a clear cause, lack of sleep or too much of sleep, difficulty in thinking or remembering. I shall request you to just pay attention to these points, and when I shall switch over to Ignatia, you can see the same symptoms, how these symptoms are getting developed in Ignatia. All these symptoms are found in that drug. Then there is alteration in appetite, dependence on mood altering substances such as smoking and alcohol. There is unusual anger or irritability, self isolation from people or activities. People is getting easily fatigued, and experience of new and unexplained pain. And these characteristics of emotional distress may vary depending upon the presence of any underlying mental health disorders. Example, in a person with borderline personality disorder, emotional distress may cause both angry outbursts and intense feeling of loneliness. Both these symptoms can coexist in a single person. Now, what are the treatment, the general management? How is the modern medical world or the modern psychiatric world is treating this? The treatment usually involves identifying the triggers and practicing techniques to reduce stress. We have to identify the trigger points, which circumstances and which conditions are triggering this emotional distress within the individual. But at the same time, when we are going to identify, it's not very easy, because often the subject, they neglect to tell us the actual conditions and situations. So in this case, we see how beautifully all these things have been told in our organon of medicine also, how to take the case, how to take the symptoms of the obvious cause. We have learnt these things, and the modern medical science is again coming to these points, which we have already, which our master has already told about 200 years back, talking to family members, friends, and a therapist or counselor. So in these various ways, various persons, we can identify them and come up with various ways of coping. One of the standard method of identifying and addressing sources of emotional distress is the cognitive behavioral therapy. This therapy is applied to each person depending upon the individual situation. And there are other stress management, stress regulation techniques like box breathing, guided imagery, then breathing exercise. Another very important aspect is the mindful meditation, which is a very useful technique and a long term strategy for dealing with stress. I can tell here about this mindful technique. I myself have attended various sessions about this mindful techniques, and it's a beautiful technique where the focus is within the individual. You have to raise above the doership, your inner ego, and you have to always scan your each and every actions. You have to be mindful. That means if you are breathing, you have to watch your breath. You have to take some time out of this your busy schedule, and you have to go deep into within yourself, and you have to watch your breath, you have to watch your thoughts. In this way, you can raise above the situations of stress. So this is a beautiful technique. If anybody is interested, you can contact me personally. Combined with homeopathy, this mindful technique is a very, very good uh, management for this daily stress. So another is making changes in the lifestyle habits, such as quitting smoking and habit forming substances. Regular physical exercise, it's a very important, and many studies has been found, has shown that this physical exercise alleviate anxiety and depression. Then comes the diagnosis. Actually, there is no specific clinical diagnosis of emotional distress, because anybody can experience it, and it can be a part of mental health disorder. So it's very difficult to diagnose whether the person is actually undergoing a stressful situation, or it has already circumpassed into deep mental health disorder. And really, it's very difficult to distinguish between emotional distress and depression or anxiety. To help a person identify the cause of their, the doctor may ask about the recent experiences and major life events that may be the sources of distress. So we have to very much tactfully again inquire from the uh, close relatives, close friends, and the person himself, by assuring him or her about his uh, secrecy, and we have to identify what are the actual cause. And also the additional symptoms, this is very much important, that uh, how to, that could indicate a mental health disorder, such as whether the person is having any suicidal thoughts or feeling of hopelessness. So this must be inquired about. Then comes the prognosis and complications. In many cases, the emotional distress resolve on its own, when the stressful situation concludes. In other cases, the symptoms improve slowly as people adapt or find stress management techniques, as already discussed previously, that work for them. Now, when to see the doctor or a mental health professional? If this emotional distress is unmanageable or not improving, then it is obviously advisable to contact an expert, specialist, or mental health professional. Next, the prevention. How to prevent? Because we all know that we are living in a very stressful life in this third generation, in this era of 4G, 5G. We have to identify and be aware of the trigger factors at the place of work and home and take action immediately. Then we have to create a support network of colleagues, friends, or family members. We can also join a support group comprising of people having shared experiences. Then it's a must staying physically active and having a healthy diet. There is a saying in Bengali, "Olosh mostisko শয়তানের কারখানা." That means if sitting idle, your mind also becomes idle. So keeping engaged in a lot of activities, be it physical or be it mental, keeping engaged in various hobbies, it really helps to combat stress and prevent this emotional distress syndrome. Like I have already, again, these next points, this taking breaks often from routine work and life. You go for an outing, you go and enjoy with some friends, and then you go for some tour, a long tour or a short tour. In this way, you can break the monotony of the daily routine work. And another is avoiding smoking. I have often heard people who smoke, the smokers, they tell that if we smoke, it helps us to reduce the stress. Actually, that is not. The smoking and this depending upon this habit forming substances, they actually create a vicious circle. As soon as those are removed, the person again becomes stressful, and they again in turn resort to these habit forming substances. So we must, by any technique, try to remove these habit forming substances from the daily life of the individual. Then practicing stress reduction techniques. Again, I told about this mindfulness meditation. We have to practice this regularly. Now, Ignatia in emotional distress. Actually, we all know it's useless to go into details because everything is known to everybody about Ignatia. It's a very common drug in practice. It's a very important drug in our syllabus of the Materia Medica. So we all know that Ignatia was introduced by our master Hahnemann, and it was fully proved by Hahnemann himself. And where it has been found, this is just an information. 620 of the 795 symptoms are ascribed to it in the third edition of the second volume of the Reni Azni Metellere. And 620 symptoms are his symptoms. The rest of the symptoms have been given by his followers. And it's a very important, what is the active principle? Strychnine. In Bhaumik also this strychnine is there, but the content of strychnine in Ignatia is far more in Ignatia than in nuts. And it acts upon the spinal nervous system and also the whole nervous system, giving rise to an increased susceptibility to both mental and physical impressions. That means this mental and all those physical impressions are actually being attributed by this active principle, strychnine. Ailments from, we all know, it's known to all that anger with silent grief, bad news, disappointment, disappointed love, fright, reproaches, all these symptoms just now we have seen in the trigger factors of the emotional distress syndrome. These all exciting causes are already there in the Ignatia. We can see also in the herring guiding symptoms. From the herring guiding symptoms, it's in double bold. Ill effects from hearing bad news, from vexation with reserved displeasure, from grief or suppressed mental sufferings, of shame and disappointed loves. Now, how this emotional distress is developing in Ignatia. Actually, the lady of Ignatia, usually it's being prescribed more in females than in males. That doesn't mean that it cannot be prescribed in males, but usually the females, it's considered as a female remedy. There's high ideals and expectations. As if you go through the writings of the Vitulkas, there he has very beautifully explained that Ignatia is frequently indicated today because of women's liberation movement. That means this women wants to liberate, assert herself, and they have a very high ideal and expectation to do something in this society, to contribute something in the society. And this strong drive to do something make them truly critical. And in this process of doing so, they become very much intolerant to contradiction. In the repertory, you can find this rubric, mind, anger, contradiction, from Ignatia in a higher grade. So what they do, they develop an environment of imagination. What should be her partner, what should be her world. They create an environment of imaginary environment within herself, and then comes the conflict between this imagination and realism, and these conflicts shatters her to such a level that she becomes and subjected to this emotional distress syndrome. Let's see how. Here from the herring guiding symptoms, again in this slide, I have shown how in the herring also, in the source book, what is written, that slight blame or contradiction excites him to anger, and this makes him angry with himself. This woman wants to liberate herself. So there is a strong sense of inner duty developing within these women. Competence, quickness, and refinement used to achieve goals in the outer world. Just now I have discussed it, how they constantly have an high ambition and how they try to achieve the goals in the outer world. The very light woman wants to be equal to man, and there is a constant conflicts with the inner state. Inner state, she's a woman and she's trying to become like a man, and this inner conflicts is giving rise to all those array of symptoms, like delusion, she had committed a crime, delusion as if she is being criticized, delusion as if being doomed, delusion has neglected duty, delusion as if she has done something wrong. Why? Because she is already trying to be like a man. She wants to do her duty like a man. She wants to take care of her parents. So there is constant conflict within herself. Am I failing? Am I failing in my duty? Am I failing in my achievement? Am I failing in my goal? And this is constantly being playing in her mind, and this is leading to self reproach. See, again, you can see in this herring guiding symptoms, it's again in a very higher grade, anxiety as if he had committed some crime. Like I said, there is a constant anxiety. I'm not doing my duty. Maybe just my brother is doing duty, and I'm failing to look after my parents. I'm failing to take care of my child, I'm failing to earn enough for my family, so I'm committing some crime. So there is constantly this is going at the back of her mind, anxiety and disquiet, as if she had done something wrong, or as if some great misfortune were about to happen. This so overpowers her that she can with difficulty refrain from weeping, and she cannot refrain. She starts weeping, but that weeping is also, we shall study that weeping is also silent, has oppression of breathing. So how this psychic is developing into these somatic problems, but feels distinctly that oppression begins at stomach and spreads up into the throat, becomes very weak, incapable of work, and disinclined to company. No appetite, she is losing her appetite. Bowels are torpid and insufficiently moved. Paroxysms about twice a day, one lasting often for hours. So these symptoms are developing, and all these have been noted in the guiding symptoms of our Materia Medica by Constantine Herring. And these disappointments excite the inner sensitiveness, but this Ignatia lady, she tries to keep it in. Often we prescribe in our clinic any event of disappointed love, we just jump into Ignatia. But we must also remember that not only in case of love, there are disappointments in every sphere. Disappointment in achievement, disappointment with the parents, disappointments regarding neglection. My parents are they love my brother most, and I'm not being getting loved. So there is disappointment. My husband does not love me. My husband is not dutiful towards me. My husband is uh, uh, neglecting, is indifferent towards me. I have been dejected by my lover. Maybe my lover does not love me much. So there is disappointment in every sphere, be it from love of his partner, be it love from his parents, be it love from his any family member, be it love from her immediate colleagues. Everywhere disappointments in every sphere. You can see in the Herring guiding symptoms, these things are given: melancholy after disappointed love, and this is always being combined with the spinal symptoms. This is again being attributed to the presence of strychnine within the Ignatia. Silent grief and brooding, and this disappointment leads to a constant brooding within the Ignatia subject. And obviously, you all are aware of that this is being aggravated by consolation, leading to a contradictory and alternating states. So there is always a contradictory and alternating state. Patient is laughing, at the next moment she is gone deep into some thoughts and she is lost somewhere. And also in the physical symptoms, this contradiction is very much prevalent. So that I'm not going into much details what kind of contradiction. You can, anybody can open the Allen's keynotes, and there are lots of contradictory symptoms given there. Now here, uh, there is a very close association of Ignatia with the natrum mur, because these two are the leading remedies considered by most homeopaths in the treatment of deep or prolonged grief reactions. So how to differentiate? Actually, natrum mur is usually much more refined and much more silent and much more chronic in nature. Ignatia, on the other hand, is not very much refined. Ignatia is usually hysterical. Her motto is to draw the attention from the person or from the situations from where this disappointment is arising. But Natrum Mur just secludes herself. Natrum Mur does not go into that stage of hysteria. But Ignatia always goes into this stage of Ignatia. She will have sudden pain in the uh, stomach, suppose, and she will start crying loudly. When she sees that nobody is paying attention, then this is again causing disappointment within herself. Then she will just go into a seclusion and go on sobbing very silently uh, in a chronic way. So this is the basic difference between Ignatia and natrum mur. Again, these two I have cited from the guiding symptoms of Materia Herring's guiding symptoms. Now, how does this mental distress is being expressed by an Ignatia subject? How these circumstances to which she has been exposed to, how is she reacting? How is she expressing this constant involuntary sighing? You can see the lady. You can get many patients coming to our clinic. They telling the symptoms, and this constant sighing is there. This is again a result of her hysteric behavior. Then there are often emotional outbursts very quickly. Very quickly she reacts, but again very quickly controlled. Only tears in the eyes, short sobs, sighings, constant swallowing, twitching around the mouth, bites inside the cheek, etc. There may be sudden outburst and suddenly, very quickly controlled. There may be tendency to overeating, there may be ravenous appetite, and which may be alternating with anorexia. Bogger has rightly said, empty sinking in stomach, not relieved by eating. Often the person will feel hungry. We have seen in the symptoms of this emotional distress symptoms when we were studying that there may be loss of appetite, or there may be voracious appetite within the person. Spasmodic or erratic symptoms full of contradictions. Sensation of lump in the throat, it's again a very hysterical in character. Aversion to fruits, loathing of tobacco smoke, perspiration mainly on face while eating. The person will eat, but the whole face you can see the perspiration. This is a sign of nervousness and anxiousness. Nervous cough aggravated by coughing. Now we shall study two of the cases. One case I have given here, another case, my case, which I have not noted over here. I shall tell it spontaneously. Actually, I had the opportunity to interact with many homeopaths all over India. Still now I do have. So this is a case of Dr. Neelam Avtar Singh from Patiala, Punjab. I learned it. I got an opportunity to learn this case from herself. So I'm just putting this down. Uh, this is her experience. A patient, a female, 37 years, came for the treatment of severe sinusitis from which she was suffering from her childhood. And she used to feel swelling on her cheeks, especially beside this nose part and the frontal part of her forehead. She stated that she had tried all kinds of medicines. She tried allopathic, she tried homeopathic also, Ayurvedic, and one thing she told that whenever she takes homeopathic medicines, there is a severe aggravation, and all her conditions, these conditions, get aggravated. On further inquiry, what the doctor found that basically she suffered from depression and insomnia, for which she has been taking sleeping pills regularly for many years. And during the severe attacks of that sinusitis, she took Avil, which gave her instant relief. On further inquiry about her nature, she confessed to be quite aggressive but kept everything within herself. If she shouted at someone, the feeling of guilt engulfs her. She tolerates everything and there is much suppression of anger. She likes music but doesn't watch television. She doesn't like to wander around or travel anywhere. She also told, on further inquiry, that she was going through a very bad phase in her life and there are chances that she might get divorced. And after assuring her of secrecy, she revealed her grief stricken story. What is that story? The story goes like this. She got married 4 years ago to an NRI and he remained with her for about 2 months. And before going back to America, he told her that their relationships could not work. He told that he gave his married life a period of 2 months and he felt that they cannot live together for the whole life because they fought over trifles and he wanted to end the relationship there itself. He asked her not to wait for him as he would not come back for her. Since that day, she is under depression. She feels as if she has been deceived. But the most important factor is that she still loves the person and has never thought of marrying again. She felt that she was ruined and everything was over for her. She has lost everything and there is no charm left in her life, because of which she doesn't want to enter into another relationship. She is not able to forget him. She is helpless and has lost interest in her life. She does not want to do anything new. She does not have interest to take any new undertaking. Now, what's the theme of the case? In the whole case, though the girl had sinusitis, but her mental state was very much important. A feeling of deception is found throughout the case. She feels that her life has been ruined and she has lost everything. She has stopped taking interest in new things. Though he deceived her, she still loves that person and doesn't have any hatred or revengeful feeling for him. The most important rubric, ailments from a disappointment and deception, gave about 10 to 12 medicines in common, but with a different mental state for each of them. Out of these, some medicines had hatred feelings, so they were ruled out because she still loves the person. The left out medicines are Ignatia, Nux vomica, Veratrum, Lycopodium, Pulsatilla, Sepia, and Marxol. And next important factor was that she had lost interest in everything. Now the rubric initiative lack of was considered and only Ignatia and Lyco were left out. The medicine was clear as the factor of being ruined and lost everything is there in Ignatia. So the prescription, Ignatia 1 m single dose was prescribed by her, followed by a placebo for 15 days. After 15 days, she said, I'm 100% okay, perfectly all right. I feel it's a miracle for me and I have not taken Avil since 15 days. I always had some aggravation with homeopathy previously. After 1 month, her sleeping pills were discontinued and she never returned for more follow-ups. Now, case 2. This case is actually mine case. I have treated this case. I'm treating this case. She's already under my treatment. It's a case in my present current place of posting in Mahesh Bhattacharya Homeopathic Medical College and Hospital. Here, in a OPD, a patient, a lady came. By looking at the lady, she was uh, around, I thought she was around 50 to 52 years old. She was complaining a constant roaring sound within the ear. And so what happened? The other my interns and house staff, they jumped into that particular symptoms, roaring in the ears. They started seeing the repertory. Then I told them, wait, let me see. We investigated the ear with the help of an otoscope, and only some few dirt particles were found, and no such pathology or something, anything were found. So on further inquiry, I found that the lady had a very sad look in her face, and she was stating the symptoms in a very monotonous, in a monosyllable tone, in a very monotonous way. So I asked about her family,
Sorry for the
and
interruption, Dr. Aniruddha. Can you
yes,
hear me? Ah,
yeah, I can hear
actually,
you.
we are very shortage of time.
Yeah, I'm just
So
winding up. Yeah, I'm just
sure,
winding up.
sure.
This is the last case.
Thank you,
Yeah,
thank
and I inquired about. So I found that she had some this cases of constant the trigger factors which we just studied, that she had been neglected, she felt neglected in her family. She is the, we call in the Bengali, the eldest daughter-in-law, but her younger daughter-in-law always overpowers her, and her mother-in-law always, her husband does not has a good income, and mother-in-law always gives her जो जिसको हम लोग बोलते हैं ताना मारना, she does that. So again, I was confused between Ignatia, Natramur, Sepia. Then, after looking at the OPD ticket, I found her age is 62. And to my utter surprise, I asked her, the আপনার কি এই ওপিডি তে বয়সটা যেটা লেখা আছে এটা কি ঠিকঠাক লেখা আছে? আপনার কি সত্যি 62 বছর বয়স? Then she said, yes, I am 62 years age. I am above 60 years. But to my utter surprise, not a single hair is gray. Her skin was intact, and she was looking like in her mid 40s, 45 to 46 years. So then I jumped into Ignatia because it's a very contradictory feature. Then I inquired about her other features, that she has a very great aversion to tobacco and all those things. They all matched, and I prescribed Ignatia 0 by 2. So what happened after taking Ignatia 0 by 2? 75% of the features went away. Then I prescribed Ignatia 0 by 3. But what happened, this actually happens with the LM potency. We have to keep a constant watch. After taking the 0 by 3, again the conditions aggravated and she took allopathic medicines. Now I have kept the person in PL and I have asked her to come for her next visit. So this is about my case. Now I'm concluding with a saying of Dr. Rajan Shankaran, as he has rightly said that the nature of Ignatia is like that of a woman who has invested her entire emotional bank balance into an individual. She is very sensitive to the behavior of that individual. Any misbehavior or rudeness on his part affects her profoundly and causes grief or sorrow. The only way this mild woman feels she can bring him back to good behavior and restore her equipoise is hysterical manifestation on her part. When she is disturbed, any consolation only aggravates her condition. She is like a young woman in love, and her future depends upon her marriage to this man. She has put into this man so much of herself, it is as if she is already married to him. That's all. Thank you.
Thank you so much, Dr. Aniruddha, for your wonderful presentation on the topic that Ignatia distressed mistress. And you have rightly pointed out some emotional distresses, their implications, and how to prescribe Ignatia in such cases. And nicely, you have given these cases, description of the cases of your own and some other cases. These are worth mentioning, and this is very important for us also to get an overview on this distress mistress and how this Ignatia is going to help us in our clinics. And regarding this Ignatia, many things may be mentioned in many aspects about this Ignatia. So we know that emotional distress is a very key point for Ignatia patients. And this Ignatia, it's due a favorable reaction from this remedy Ignatia, and it shows a definite stiffening of the moral fibers and clearer the understandings of the particular problem and lifting of the defeatist attitude. And we are indeed fortunate enough to have our Ignatia and the similar remedies, similar like remedies at our hand for giving a clear-cut picture of tragedy in the pathogenesis. So we hope that we have get much views on this Ignatia, and we are enriched with the topic. And I must be again very much thankful to our viewers. We can see that more than 200 viewers were there for this live session, and it counting about 225 like that, and maybe more than that. So we are very much thankful to all the viewers for your constant support, constant presence, and for your continuous support in the previous webinars as well as today's webinars. And we are expecting that in future webinars we are going to get your constant support and your presence. And your presence means a lot for us, because without your presence this webinar is not a successful one, it's not a fruitful one. So again, I am very much thankful to all the live viewers for your presence in this webinar. So I am just now going to Dr. Bidyut Mukherjee sir. He will be giving some appeal and instruction for us, and after that we will be moving to this question answer session.
Thank you, Dr. Swapan, and both the speakers tonight. It's excellent session from both of you. With permission of Kalyani sir, it's a humble appeal to all the alumni across the globe that we are conducting CME. This is the 41st CME online, and before that we had been conducting uh, physical CME at NIH campus. But there are so many alumnus across the globe we are having who, during the past few years, some of them were in distress and many of them had left us. So we had started a benevolent fund to help our alumnus in need, and based on your suggestions. So the bank account details are given in the description of the CME and all the CME in the YouTube channel. Uh, Also, we request all the alumni. Very recently, uh, probably 32nd batch or some batch had completed their graduation from NIH. So another batch is inducted in the Alumni Association. So across the globe now we are having almost 2000 plus alumni. And please come forward to contribute and help each other to help themselves in times of need. Now, over to you, Kalyani sir and Professor Swapan Pal for the question answer session.
Let us first continue the question answer session, Bidyut.
Sorry, I may
Yes.
have missed part, because due to my internet connection, I
Oh,
just cut off.
okay. We have two winners of the quiz contest, of whom I saw Shoaib Ahmed is in the studio. Now, the first chance will be for Shoaib Ahmed to ask question from either of the speakers. Shoaib, also is Shoaib here? Yeah.
Sir, I
Shoaib,
thank you
please
so much,
introduce
sir.
yourself.
Thank you so much, sir. I'm so grateful. Sir, myself, Shoaib Ahmed, sir. I am the Medica of the Medinapur Homoeopathy Medical College and Hospital in the second year, sir. Sir, I am so thankful and so grateful, sir, for to me to myself. Sir, I have only, sir, only one question, sir. What is the commonest integrate negative tropical disease? And how, sir, I measure or prevent this? This is my query, sir.
Over to you, Dr. Himadri, and our moderator, Professor Swapan.
Yes, I
Dr.
got your
Himadri?
question. Yes. Hello.
Yeah.
Can you hear
So
me?
what is the commonest type of the neglect and how? Yes, sir. Yes, sir. Of
Yeah.
course, yes. Me. Yeah, Mr.
Yeah. Actually, WHO has found initially 13 major, entities over the world. But after doing much research work and the data, what right now we are having 20
Yes,
common
sir.
neglected diseases are more prevalent in world. Out of these 11 are more common in India. And in 11, as I already have shown you the slide, that the scabies, Visual leishmaniasis, soil transmitted helminthiasis or different helminthic infections, these are more common in different parts of our country. And your second question is like how to prevent. Yes, as my topic was like this was the integrated approach to control the different entities which are commonly available in India. So we have some approach, and out of those approach, two or three approach are very important. First approach is mass drug administration, means we can like identify those endemic areas which are more prevalent to different these common entities. And we can have some like from homeopathic point of view, if you say, then definitely we can go for some genus epidemicus for different diseases. And as we already have done different research project also for on different these entities, so we can have mass drug administration to those areas. And with that we should look out for the basic sanitation, proper hygienic conditions, and safe water supply. These are basic ideas which we should take out. Thank you.
Thank you, Dr. Himadri, for your explanation to the question asked by Shoaib Ahmed. And one more question has been given in the chat box to Dr. Himadri, that you have mentioned about homeopathic chemotherapy. Some doubt has been raised regarding
Yeah,
this nomenclature. So, can you explain what about
yeah.
this homeopathic chemotherapy?
Yeah, exactly. Yes, it is not exactly chemotherapy. Actually, WHO have used this preventive chemotherapy to use some common drugs, like in mass, like mass drug administration. Like if we take example like helminthic infections, they are usually they are giving these ivermectin, albendazole, or like such other kind of drugs like your pyrenthal group of drugs, or your levamisole, like kind of these drugs they are giving. So these chemotherapy words they have used, it is not like chemotherapy anti-carcinogenic drugs or like that. It is they have used to combat these situations. They have used like in like to control those different diseases which are more prevalent in different areas. So in that aspect, means like we can add our drugs also to control this situation. It is not like anti means like whenever we heard like chemotherapy, like so means like towards means we supposed to like mention about anti to prevent to prevent cancer and all. Not like this. These word they have used in general, like to come to administer the different available drugs in en mass. So as we also have a lot of scope to identify those endemic areas, and we can easily develop our genus epidemicus, so that that area we can ruled out, we can have some more research work, and we can come up with our drugs. That was my motto.
Thank you, Dr. Himadri, for your explanation regarding this homeopathic chemotherapy. Actually, it is not the so-called chemotherapy as you have mentioned. It is purely an homeopathic aspect. In a broader aspect, you have just tried to mention that area. Okay, thank you so much. Any other question in the chat box? I don't have found any other question in the chat box. So we
No,
can proceed with
no
the
more
next part
questions.
of this. No more question.
Eh,
Okay.
Yeah, over to now our president, Kalyani sir.
Thank you, Bidyut. Many thanks. Many thanks to our inaugurator, Tousif Jamal Wasim, our moderator, Dr. Swapan Pal, for his nice moderation. Himadri for his extensive discussion on the uh, NTD diseases, and Aniruddha for nicely explaining distress mistress. It's a very nice seminar, and there are a number of participants. Only two things I like to add to this beautiful CME, that brothers and sisters, today more than 200 viewers are observing this CME. So to make it successful and to respond to the call of today's brilliant speaker Himadri, if we can collect before, during, and after treatment reports of 2 cases in a long few years, only 2 cases, then we will be able to show the modern medicine world that we have cured more than 400 NTD cases. That means what I want to tell you, that please be serious to provisionally diagnose the case, then try to do some investigation, simple investigation, stool, the easily available stool, microscope examination, if possible, some other very low cost investigations. Just keep the records and try to produce those documented cured cases of NTDs to the scientific world. That will be really a great help to the national or international problem, the global problem of this neglected disease. So let us all hope that all of us must try to keep documents of curing of these cases, and I am very sure that many of you has cured number of cases on this subject. So please keep the records and try to convey to all of us, by which all of us will be encouraged for the right help. Other things, financial support, political supports, and other things, there are persons who are responsible to do it. We don't have that much of powers and qualities and abilities, but the ability we have already, that we can cure the cases and show the documented record cured cases to the scientific world. Please try to do it. Now, one more thing I want to add regarding the distress mistress, my teacher's suggestion from Calcutta Homeopathy College, and many times you have heard from me that Calcutta Homeopathy College was very famous for keynote prescription. Our teacher used to tell, if you find a marital lady, marital means pre or post, before marriage or after marriage, that means average from the age of 15 to 35. If you find a marital lady, desire for solitude, first think of Ignatia, then think for others. That means the most fatal sign of mind is suicidal attitude. If not schizophrenia, once any patient wants to suicide, like aurum metallicum, it is the most severe, dangerous symptom of mind. Immediately that should be controlled, otherwise we are going to lose the case. The second serious mental symptom is when a lady is withdrawing herself from the whole world. That means desire for solitude, do not want to meet others or interact others. So dear friends, this was my teacher's assessment and advice, that whenever you find a marital lady with desire for solitude, think first for Ignatia, then think for others. If not Ignatia, then think for others. So anyway, today's seminar is really very successful, and we hope that in forthcoming seminars, all of you will participate. You will inform us regarding good speakers to whom you do want to listen. Many thanks to all. Thank you very much. Good day.
Thank you. And with this, we will be meeting again on 13th of February for our 42nd episode of Online CME. And we are returning back to our backstage editor. We'll request our tonight's speakers and others in the chat box what to do next. Over to Orko.
Thank you all. Thanks for watching. Sorry for this. Thank you all. Thanks for watching. I hope you have liked today's live stream. And if you have liked it, so please do share it with your friends, with your fellow colleagues, with other homeopaths so that they also get the continued medical education which we are providing via our channel. And we have some highlighted points which are in our channel of other previous topics which we have talked about. You can go and check over there for that short topics. And also we would like to thank everyone for staying with us tonight and for staying with us till this end and be with us for more. Also, we are very close to reach 1.5k subscribers. So let's hope that you just promote us. You just, if you like our content, do just help us to get to more subscriber counts. And with your help, we cannot do anything. So again, thanks for everything. Thanks for subscribing us. And also, if you haven't subscribed yet, so what are you waiting for? Just subscribe now, and you will be getting notified. Means you will, and also click the notification bell button, which is right beside that. Just click on that and click all, so that you get notified as soon as we schedule a new CM. So until then, follow us on Telegram. Sorry, subscribe our channel on Telegram. Means join our channel on Telegram, and over there we also just provide you with the CME link and the registration link for which you can just register and do the quiz competition. So this was it. And with this, good night to all of you. Follow us on Instagram and Twitter. Good night. See you in our next CME. Until then, it's me, Medica Mukherjee, signing out.